The first wave of the overdose deaths related to prescribed opioid is in 1990. For the first time, the U.S. life expectancy had decreases compared to the other developed countries. National Library of Medicine 24/4/18 say that the rise of the opioid-related deaths toll have been 3,000 in 2099 and rose to 17,000 in 2021. And today I will persuade you that why the drug should be regulated and mandate physicians to have advocate to rehab program and inform the patient of the risk involved when using the drug. First, I will find the effect. First, I will inform you that the effect of it to the body, and why people seek legal sources to please their effect of the drug. Second, I will tell you that the physician is over reliant on the system and it's failed the patient because it's generalized the use of drug to as a solution to pain. And third, I would say that this system could be prevented through standardized testing and implementation of the patient itself. The risk, first I will tell you about the risk and then the legal sources. The risk stem from the pain that the patient accumulated over the year, and they find that it is easy to alleviate the pain with drug. And according to the National Drug Abuse from June 2012, say that the drug itself bind to the receptor and activated and block pain receptor. This will create a dopamine loop that will reinforce the loop itself and lead to the constant seeking and intake of the drug to not break from the cycle, and it's really lead to over dependent on a drug, like an addiction, and this will lead people to go to illegal substances and sources, and they import it from other country substance like cheap fentanyl and heroin is in the U.S. market, and it is diverged from the pharmaceutical sale, legitimate pharmaceutical sale, and the distribution of treated prescription have been widely increased throughout the year. People will readily switch to the alternative itself rather than go to rehab. National Library of Medicine of January 4th, 2012, that the illicit heroin infection is an international problem and can lead to hepatitis and HIV infection when using the same needle. And with 13 million injections, according to the World Health Organization, the annual internal medicine say that 1/3 of the U.S. adults have used opioid as a pain relief, and it is the 80% of the world opioid supply. Surgeon General Murphy say that it is the most common disease in our time. It's impacted ethnicity, sex, and socio-economic background. And according to National U.S. Poison West, say that the epidemiological evidence that some of it have been overdosed due to as a overlooked suicide attempt. 65% to climb up to 75% of cases have been categorized as suicide attempt. It is an inconvenient truth that epidemic presence that is having like a limited perspective on the dual disorder. Evaluation and treatment of such thing should focus on individual that meet criteria for major depressive disorder, and physicians should implement the preventive measure before giving out surprise drug. They should be comprehensive rather than preemptive treatment. The under-treatment fueled the opioid epidemic in 1980. One paragraph letter of the New England Journal of Medicine say that and challenge the practice of only using for relief to acute pain. And the retrospective review recorded from November 8, 2012, that patient could not become easily addicted to them. This slowly expanded to anyone who want to alleviate their pain and use the drug more easily. And the American Academy of Pain Medicine even issued a consensus statement that opioids should be used for non-cancerous cases, pain, and advocate for more aggressive use of opioid in 1986. And in the Journal of Pain, only 38 patients are tested to come to the conclusion that opioid should be a method and theory as a safe and humane option to surgery or other treatment with the source. And from 2010, Patient Protected Affordable Care Act of 2010 say that they expanded the role of the patient satisfactory as the payment will lead to the incentive for a physician in hospital to fund the value-based program, which reward the hospital for high-quality care by requiring the measuring of patient outcome and experience. So the score is based on patient relief and not in pain. So it's influenced the use of the drug in the hospital itself. because patient wanted to alleviate their pain using drug as an easy means. Influential like in patient, and this will the more score it is, the more prospective the payment system in hospital is. So clinician is obligated to subscribe more powerful drug even if it is not necessary. Cut from the minor chronic pain from 21, the institutional of medicine in cross quality say that the new 21st century that the US system have not delivered and does not provide consistent care and high quality evaluation for medical patient. And the solution is that the generalized adhere to the satisfactory scale and skew with the term of treatment. Ruman and colleague had delineation of the major processing on the March 18 feel that prescription opioid is an addiction treated as a relapsing disorder rather than a one goal, and undergo evaluation for detoxification and monitoring within 5 years with urine testing and consistent evaluation and examination. Treatment combined with psychiatric issue and mutual support of the group have been evaluated. That's 80% that it will be effective to rehab the patient. And the solution to the illicit drug could be the partnering of the law enforcement and public safety official, and equip them with the skill to use Nexanox, a rescue kit that could help the emergency cases of overdose a victim, and it's find in the rural state home of reduction from November 1st, 2023. That's only 15% of the patient use Nexanox die from the injection, and help them the risk of opioid harm and position to prescribe. I hope that I explained that the risk of opioid harm to the body and physician position to prescribe the alternative program to the patient rather than only rely on drug to alleviate it and treat the patient with pain, that going through pain.